All right, everybody. Welcome to another edition of Conversation with Coach Kevin. I'm your host, Kevin Thornton, the Wellness Architect. And before we get started, please like, subscribe, and hit the notification button so you get more videos like this on your YouTube channel. Today's guest, I am very happy to have on my show. I'm extremely proud of this person. You know, when you grow up with people, you go to school with them, you see the journey that they go through, and you see who they become. It makes you very proud. And so to see this young lady become a doctor and now a published author, it really makes my heart proud. So, because I knew this person back when she was a young girl trying to become a Delta, and now she's
Oh,
not only she's a Delta, but she's a doctor and she's doing amazing things. Let me introduce to you Dr. Rosalyn Miller.
hi,
Hey,
Kevin. Hey, hey.
how, how are you?
I'm doing well. No complaints. I'm doing well outside of Houston. Weather's holding up. We're doing great. We're supposed to get a freeze or more cold weather, but right now we're doing good.
Good. So, for those who don't know you, tell everybody who you are and what you do.
Okay. So I am a board certified obstetrician and gynecologist. I've been practicing for about almost 20 years now. And I have been involved in women's health. I mean, I've always kind of gravitated toward women's health. That probably started in medical school. So I do everything in terms of women's health. I'm still delivering babies. I'm a surgeon. So I cover women for the most part of their whole reproductive lives, from the beginning of their cycles to when that cycle ends, birth of their children. We deal with contraception. We deal with, like I said, management of women's health issues in terms of, bleeding issues, fibroid issues, if they require surgical intervention, such as hysterectomies, medications, all of those things. So that is what I do in terms of my job. I'm also a wife. I'm also a mother. So that is the other aspect of my life. And yeah, so that's me. That's what I do.
So, was being a doctor always your vision for yourself?
Actually, it was. I was one of those people who knew probably from age 6 that I wanted to go into medicine. I wanted to be a doctor. I didn't at that point know what kind of doctor. There were no physicians in my family, so I didn't have a blueprint of how to do this.
Mhm.
I just knew I wanted to be a doctor, and I didn't have a plan B at all. Um, which is, strange for, I guess, a lot of people, but it was one of those things where I think as a child, I said it so much, and my family always supported that. So it was never a situation where I felt like I couldn't do it. I don't think it came to an issue, or the first bit of doubt came up until I got into college, when I met with an academic advisor and I told him, what my goals were, and the response was, well, let's put you in this particular curriculum in case that doesn't work out. So that was one of the first times I was like, what do you mean in case this doesn't
Right.
work out? So yeah, I had to navigate how to become a doctor pretty much on my own, in terms of what, the classes that I needed to take for the MCAT, which is your medical college admissions test,
Mhm.
what that looked like. I didn't do well on it the first time. So trying to take it again, having to pay for this test, trying to figure out how I was going to pay for this test. So a lot of it was just buckling down and realizing this was something that I could actually do. The first time I saw, because I was born and raised in a small town, there weren't any Black female physicians essentially in my hometown at all. The
Mhm.
first time I saw one, I was actually in college, and
Really?
I was working at the hospital at what was our little Ann Arbor hospital by the school. So
Okay.
I was working over there, and
Mhm.
I was in the cafeteria, and I saw this Black lady with the white coat, and I looked at her badge and her name, and it, it said Dr. Blank. And I remember instantly thinking, "Oh my God, like I should say something to her. I should meet her." And I mustered up the strength to say something to her, and she was extremely, and I think she was so warm and so nice and gave me her information, and if you need anything, let me know. And but that was literally the first time that I had physically come into contact and laid eyes on a Black female physician.
And that's the reason why, you know, I said I have to interview you as I
Mhm.
start the new season because I'm by the belief of what you see is what you be. And
Yeah.
we can't expect our children to grow and be anything outside what they see, which is rappers or athletes, if they don't see people like you,
Mhm.
and know that it's possible. And so,
Mhm.
so I said, she's doing amazing things that the world needs to know about. And so hopefully little Black girls and Black boys
Right.
be inspired by you and say, you know what, I want to be a doctor as well,
Right.
you know.
Right.
And then especially as we get in touch to some of the issues I want to talk about,
Mhm.
um, I think maybe it'll inspire them more so because we gonna need more people like you to be the caregivers and the vessels to help us in our health in our health
Right.
journey.
Right.
So one of the things, on a personal part is for me is is breast is breast cancer hereditary?
There is some hereditary predisposition to breast cancer. Patients can have or carry a gene for breast
Mhm.
cancer. And if they carry the gene, it also can put a woman at risk for ovarian cancer as well. But we're seeing an overwhelming amount of women who have breast cancer that don't have the gene. I think that's important to note because you want to make sure you're getting your screening regardless of your, genetic risk. You want to make sure you're getting your screening. So at age 40, we're getting our mammograms. You want to
Right,
get those done yearly. If you do have a risk of, or you do have a family history, first degree relative of breast cancer, some patients actually start their screening prior to age 40. If your mom or your sister was diagnosed before age 40, you would want to start your screening before then. And remember, breast cancer is just not just women. Men can get breast cancer as well. So it's
right.
all mammary tissue. So we have to be aware of that.
The reason why I asked is because, like in my mom's side, her
Yeah.
and a lot of her sisters have all been diagnosed. So I was wondering, was that hereditary? And I know some of the other cousins as well has been diagnosed as well.
Yeah.
So
So I think, it's important that if someone has been diagnosed with breast cancer, that their oncologist, I mean, anybody can run a gene panel. I can run a gene panel, a genetic panel in my office. So if I have a patient that comes to me and they say, Dr. Miller, my mom has had breast cancer or my cousin has breast cancer, it's easy. I can run the genetic testing in my office. If anything comes back abnormal, then I can also send them to a genetic counselor who will then help them and, kind of counsel them and encourage them in terms of what to do and what their risks are.
right. Now you stated something as you were telling your journey about
Yeah.
how you didn't really see a black OBGYN until you got to college.
Mhm.
So with that being said, so I know especially here in the South, there's a lot of issues with um modality and
Mhm.
more mortality and mortality
Mhm.
regarding women having dying during childbirth and stuff like that.
Yeah.
What's the cause of that?
Yeah.
What
What's happening
and
to us?
what's happening to it, and why is it so much on our end on the African
Yeah.
American
So, we know that Black people in general, we've been disproportionately affected essentially with a whole host of things. I mean, you can name it, heart disease, diabetes, stroke risk, all of those things. And Black women, it's been a situation or an issue in this country for some time now. We are more likely to die in childbirth than our counterparts, 3 to 4 times more likely. So pretty much our numbers mimic the numbers of a underdeveloped country. So you think in a country where, we should have access to the best healthcare, the best doctors, the fact that Black women are 3 to 4 times more likely to die and, during childbirth or after, that's a huge problem. Um, it's a multifaceted problem. You have to look at why that is. Um, Host of reasons. One, access to care. There's still some significant barriers to access to adequate health care for women, Black women in general. And that could be, no matter where you are, South, North, Midwest, it doesn't matter. So, just getting your prenatal care when you should get your prenatal care, that's a problem. The other is the fact that for Black women in general, we have higher risk of chronic diseases. And so you bring those chronic conditions with you to pregnancy. So if I have high blood pressure and I'm pregnant, my risk of heart disease or heart issues during my pregnancy increases. If I have diabetes during, before I'm pregnant, uncontrolled especially, that increases my risk of, morbidity, which is just any illness in pregnancy. So those chronic conditions that we carry along, with us even prior to getting pregnant. Obesity increases complications in pregnancy as well. So you have access to care, you have the fact that we have more chronic conditions, and then you have what some of us consider the elephant in the room. You have your systemic biases, you have your racial biases, where our concerns aren't always looked at as true concerns. Our pain isn't considered pain. Our if we're bleeding, putting attention to that as soon as you notice that, as opposed to waiting until the bleeding has now reached a situation where, it's now an issue for that mom. So systemic racism, um, implicit racial bias is huge in medicine. Black doctors, we make up about 1 to 3% of the medical population. So even though you see a lot more of us in the South, which is what I didn't see in the Midwest, we're still unicorns. We're
Right.
still not highly represented at all. So it breaks my heart when you hear this new political agenda in terms of, DEI and blah, blah, blah. What that does is it kind of shuts the pipeline for doctors or students who look like me who want to go into medicine. It cuts out a lot of different programs so that you're leveling the playing field and making it more accessible for patients to have a Black physician if they choose to, if they want to.
Right. Wow. So, is there anything that the women, as in the general, can control, like do
Yeah.
better with their eating, that can help
Yeah.
prevent some of this stuff, or what do you
Yeah.
think?
So I think you want to get yourself as prepared for pregnancy as you can. So I have patients, and a planned pregnancy by far is going to be the best for you. Now, an unintended pregnancy, you just kind of come how you come. But if you can plan your pregnancy, that's going to, number one, be the best. So then that way you can optimize your health before you even get pregnant. So if you have hypertension, you want to make sure your blood pressure is controlled. You want to make sure that you're on a medicine that's compatible with pregnancy. A lot of times people are on blood pressure medicines that they can't stay on in pregnancy. So I'm having to change those. So you want to optimize your blood pressure medicine. Make sure you're on something you're supposed to be on. If you have diabetes or if you have insulin resistance or borderline or whichever, you again want to optimize that glucose before you even get pregnant. Those are some of the things that we can do, healthy lifestyle, taking those prenatal vitamins ahead of time, anything that you can do to maximize your health prior to getting pregnant. Now, the other things that you can't control, because pregnancy is not a situation where it just turns out great for everybody. So postpartum, sometimes bleeding can occur in pregnancy or during childbirth. Those things you can't always predict. For some patients, you can. Some conditions, you can't predict that. You can be prepared. You can have blood on hold. You can make sure that the patient, gets their blood count tanked up before they deliver. So sometimes you can predict that, and there's certain things we can do. But overall, a lot of times you cannot predict that. So it requires a physician to notice that immediately, to respond to that immediately, so that the patient doesn't have a adverse outcome. So, what we can do on our end, maximizing that health, what else your doctor can do is paying attention to when things start to turn bad, paying attention to when we start to see blood pressure issues creep up at the end of pregnancy, paying attention to your weight gain in pregnancy, paying attention to making sure you're on a low dose baby aspirin. Like there's medications and things that we give patients to help them prevent some of these things. So, those are that, hopefully, Coach Kevin, that answers some of your questions.
Absolutely it did. So my next question is, um, in our conversation offline, you mentioned that mental health could be
Yeah.
a cause. Can you explain about that too as well?
Yeah. So when we look at rates, morbidity and mortality. So let me explain the difference. Morbidity is essentially any situation that can cause, more, I guess, lifelong problems for moms. Morbidity. You're not dead, but you're pretty sick. Let's just say it that way. Mortality is the number of women who die, from a pregnancy related condition. So morbidity, that's where some of that maternal health comes in at. Black women, we just do not get the mental health services that we need. A lot of us start out even going into our pregnancy with anxiety, with depression. So you have anxiety, you have depression, you're not seeing anybody for it, you don't have a counselor, you're not on any medication. So then you add the changing hormones in pregnancy, and it becomes just really a lot of this. You add the stressors for some women when you're talking economic stressors. Now I got to figure out what about my job. I got to figure out daycare. So you compound these things, and it makes that stigma worse. A lot of women are afraid to ask for help. There is a stigma attached to us, where we just don't, we feel like we need to have our superwoman cape on at all times. We don't want to ask anybody. We don't want to talk about it. So you have to really look at that, because that anxiety and that depression, women, there's suicide rates are higher in Black women for that reason. In terms of after pregnancy. So that maternal health, that mental health is a huge factor in terms of maternal morbidity issues.
And I completely agree. Whether it's a therapist,
Yeah,
a coach, you have to be seen by someone so someone can help you change the narrative of how you see things, how you feel about certain things, so you won't get to this point. One of the things
right.
I also want to ask you too is, a lot of times explain postpartum depression
Yeah.
and also for the guys. A lot of
Mhm.
times guys think that's
Mhm.
not real.
Right. So let me start off. Women who have a history of anxiety or depression prior to pregnancy will have it during their pregnancy, and they're also at increased risk of postpartum depression after. Postpartum depression doesn't just turn off at 6 weeks. A lot of times we feel like postpartum is just the first 6 weeks, and that's not true. Postpartum depression can last sometimes up to the full a year after you deliver. And it has nothing to do with that woman loving their child, being a good mother. It's not that at all. It has everything to do with the hormonal changes, the life changes, the overwhelming feeling, the sleep deprivation, the not feeling connected, to needing that support. So, as a and I've had some dads bring up to me, some she's not okay. I don't think she's okay. It's a little different than the baby blues where you just I haven't slept all night, as opposed to I just don't feel connected. I don't feel I feel outside myself. I'm completely overwhelmed and I'm literally crying all the time. So you have to be mindful of it. A lot of hospitals will screen for that even before the patient leaves the hospital. But sometimes you're just so kind of elated, you're in la la land, you just had a baby, you don't recognize it yet. And so at my office, we will have usually my nurse will touch bases with my postpartum patients like a week or two after. How you doing? How you feeling? And that's when it's important. That's when things start to kind of level out.
Mhm.
And then even at the 6 weeks, when I see them in the office, 4 to 6 weeks, we're asking about it again. So for fathers, yes, it is 1,000% real. It does not mean this is not a good mother. It means she needs your support. It means that when she says, I'm overwhelmed, that you listen, even if she doesn't say it. It may mean, babe, I got the baby for a minute, go take a shower. It may mean, call your friends, have them come over, see if they can help us out. Delegated responsibilities. I tell my patients all the time, family members, don't let them just come over and sit and watch you hold this baby.
Right.
Everybody who comes over, give them a job to do. Either they come over, they bring something to eat so you don't have to worry about cooking, or they grab a load of laundry out the dryer, fold up some of these clothes. Like if people are going to come, you give people a responsibility so that they can help you, so that cuz your primary I mean the changes in a woman's body after delivering a child is unmatched. There is literally nothing on earth that compares to that. So not only are you taking care of this new life, but you're also trying to pull the pieces of you back together that have been completely changed all throughout your pregnancy. So it is really important for men to hone in on that, to recognize that in their partner and to bring it to their attention. We've seen maternal deaths, we've seen, infant deaths. So it's a huge thing and it's a really bad thing for us as Black women.
Wow. So you pretty much hit on the head because that was my next question.
Yeah.
Because I think a lot of times people say 6 weeks and they should be done, and
Mm-mm.
so people still are feeling like they have the depression past that. It seems like the guys will feel like you trying to milk it because you want the sympathy or whatever situation may be, but you
Mhm.
say it could last as almost as long as a year, which is
Oh yeah. Oh, yeah.
that's
I think and I always wonder, where did this 6 week come from? I feel like this whole 6 week thing must have came from, us having to go back to work. That's honestly what I think this came from. Like us having to
mhm,
go back to work. I tell my patients, you're not gonna snap back in 6 weeks. Your body ain't gonna look like it did. Mentally, you still not where you were. You're still very, very sleep deprived by 6 weeks. So give yourself some grace.
mhm,
Your postpartum body is not like your pre-pregnancy body. So don't put these unrealistic expectations on yourself. Your life in the same as people that, whatever it looks like on social media pages.
right,
I think a lot of times you get this idea that I had a baby, I'm supposed to be boom, boom, boom. That's not how it works. That's not how it works. And I think we
right,
set this unrealistic expectation. And for my breastfeeding moms, it's really, really tough because you have that additional responsibility that you're trying to navigate breastfeeding. If my baby's going to latch, is my baby colic, the gassiness, and all of those things. So, I think everybody deserves, honestly, some grace for that. And it's a pretty selfish thing to think that women, should just be over it in 6 weeks.
right.
That's not true at all.
It's not. One of the things I wanted to ask you, you might not be able to have to answer for it, is that I've seen the increase of women going through either using a doula and or
Yeah.
midwife.
Mhm, mhm.
What's what has caused the increase in that?
Yeah. So two different things between a doula and a midwife. And A doula is typically what's considered a patient advocate.
Okay.
You have doulas that will, help moms during their pregnancy, and sometimes they will come with them to their delivery and just to be a patient advocate. Um, they may, in terms of the decision making, in my opinion, that's up to the physician. But some
Mm,
moms don't have that relationship with that doctor. So it really depends on where you deliver, right? So
mm,
for some institutions, you're going to be delivered by whoever's on call. You may have never seen that person before in your life. This is the person that's on call. This is the person that's going to do my delivery. And so having a doula there is helpful because if there's questions, and sometimes you don't even know what you don't know. So the doula may say, hey, they're asking, do you want your epidural now or do you want to wait until later, or whatever. So sometimes they can help navigate some of the conversation. And I think in that respect, it's helpful for patients. Um, a midwife can do deliveries themselves. So a midwife is a person who should be trained in OB, and they can perform the delivery under the supervision of a physician. So if something goes wrong, then they should have a supervising physician or a hospital if this person's trying to do a home birth, where this patient can go to make sure that they get whatever surgical intervention or whatever intervention, medical intervention that they need. So what we're seeing now is a distrust of medical professionals, and I think a lot of it has to do with the uh, the awareness that this mortality issue, this morbidity and mortality, and that Black women are 3 to 4 times more likely to die. Women are afraid. Like I have patients come to me, Dr. Miller, I don't want to die, and I say I don't want you to either. Like we're gonna do this together. So
right.
there's a real true fear, and so I think some women have this distrust of health professionals, and they feel like I need to go a different route to make sure that I am heard, that my voice is heard, that things aren't just being done to me, that that I'm actually involved in my care, that I get to, ask the questions, make the decision, if I'm having to have some type of an emergency procedure, that I know what's going on. And so that's why I think we're starting to see that a lot more. I don't have a problem with it at all. I think that if a patient does decide to be delivered by a midwife, all midwives aren't created equal, just like all physicians are created equal. You want to make sure who's your backup. If something is going down, who are you calling? What's their credentials? How close are they? What is the procedure that we have in place? Because pregnancy can always be good until it's bad. Deliveries can always be good until they're bad. So you want to make sure that you're in a position where you are going to be cared for when things hit the fan, and that the person who's taking care of you has the educational background to recognize that and make a split decision. I tell women have delivered babies for centuries without me. My
Mm.
job is to make sure that I recognize when something is going real bad and I respond and react and I can deal with it immediately. That's the difference.
All right. So next is the part I'm very proud of you on is that you are now a published author.
Thank you.
Tell everybody the name of your book and how
Ooh,
can they
yeah.
buy it and what's it about and everything like that.
Oh yeah, I should have brought you a copy. So it was really cool. And I can't take credit for all of it. I've always loved writing. And even when I was younger, I've always loved writing. But I remember my daddy told me that in order to make money as a writer, you either had to be dead or go crazy. So I wasn't doing any of that. So I've always loved writing. So an opportunity came up, and it was a friend of mine that I've known for a while. And she had this idea that she wanted to write a book on resilience and just Black women in certain leadership positions, and how for us to tell our stories, how we got to certain positions, and not only just telling our stories, but the things that we had to navigate along the way, and provide some useful tools for women who are also going up the ranks. There's, physician in the book, there's CEOs, there are women who are, leaders in luxury, car brands. So, what we had to do to get to these heights, what we learned, what some of the strategies are, what some of our downfalls were, what some of the lessons were. So I'm super excited, about the book. And I think that the biggest thing is that it was designed to help women underneath us. A lot of times, we hold on to information. We feel like there's not enough room for everybody, which we know that is not the case.
Right,
And we kind of have this mentality, some of us, where I had to get mine, so you're gonna have to learn to figure it out and get yours.
right, right.
And as you know, that as a community, that's not gonna work. That's not gonna serve us.
No,
Nobody else is coming to save us. So
at
it's
all,
time for us to nobody. So it's time for
at
us
all.
to at all to invest in us and build us. So the book is called Unparalleled Resilience. um, it's actually, I'm gonna have it on my website,
Okay.
and so I can always send it to folks who want it. And I also make sure you have a copy. I'll send you a copy too, Coach Kevin, so you take a look at it.
All
But it
right.
really is. It's a powerful book, and the women that were chosen in it, our stories are no different than a lot of other women who have worked their way, up through the ranks in a lot of male dominated fields,
Right.
and a lot of fields where, I'm the only black, physician. I've worked in two cities where I was the only black OBGYN in the entire city. Two, entire city.
Really?
Saginaw, Michigan, Butler, Pennsylvania. Only one. That's it. So, navigating that space when you're in these arenas where most of the people don't look like you, not the same race or gender, and how to go from feeling, how to kind of kick that self doubt, how to kick that self doubt, and how to feel self assured and confident, and knowing that, you not only deserve to be there, but you can run that whole thing.
Absolutely. So let's start right there because you said something that, of course, triggered me was of we have to be able to be giving of what our knowledge because no one's going to help us but us.
Right.
Especially now within these next 4 years, we have no choice but to rely on each other. You know what
Hmm.
I'm saying?
Hmm.
What do you tell these men and women, young men and women who are trying to become what you are or trying to become what I am, and they're not used to struggle. We grew up
Hmm.
differently than them,
That's true.
so the struggle is a little bit different for us. So how do they be resilient, as you say,
Hmm. Hmm.
through what all is going on at this present moment?
Hmm. Um, Yeah, I was talking to a colleague about that, like just this whole idea of grit. We no, we didn't see, like, we had to literally make our way as we were going. I know for 1,000% my children are not growing up like I did. A thousand
Right,
percent, they're just not. So it's my responsibility to teach them the value of work ethic, hard work. They see their mom, their dad, they see us working hard. So, you have to always put the spirit of gratitude, being grateful and learning as you go. But I think the most thing that's important for people who are coming under us is you have to seek a mentor. And I think that that's one of the hardest things for us. Actually, it's probably easier for them than it was for us because we were uncharted territory. My
right,
parents worked for the automobile industry. I think my parents probably stopped checking my homework when I was probably in the fifth grade. Like,
right,
at that point, I was, I was beyond pretty much what they were able to do in terms of math and whatnot. So they just made sure get it done. Nobody was checking it, but get it done. So,
right.
so they definitely have what we didn't have. They have the avenues for mentorship, seeking that mentorship and being able to listen. And I think it's now really a two-way street because I'm learning a lot from younger people, now. Like they have this huge spirit of entrepreneurship that
Mhm,
I think is so dope. Um, I feel like I was told go to college, get
mhm.
your job, and just work until you're done.
Right,
Where now it's like, I'll go to college if I need to go to college for what it is that I want to do, which makes
mhm,
perfect total sense. If
right.
what you want to do doesn't require that, then fine. But if it does, then there you go. But this level, this spirit of, yes, I want a seat at the table, but I'm also okay with making my own table. I love that. Like I love that. So that mentorship and that learning, needs to be a two-way street. So finding a mentor, trying to find somebody who you see in a position that you want to be in, and sometimes it may be an ally. Sometimes it may be an ally. Sometimes you can use, because it's been a lot of non-black people that have helped me as well. I've
Okay.
learned a lot. So finding, whatever that mentor looks like, whatever that person looks like, to help you and to figure out what it is that you want to do, is important for sure.
So what is next for you in your journey?
So, I'm at this cusp, right?
Uh,
Where you like, okay, I done went to school for this, I've done it. And I feel like I've been doing it, like I've done it. Like, you know what I mean? So
mhm,
so now it's a really cool phase of life where you try to figure out those other aspects of yourself that you also want to tap into,
mhm,
and that includes my writing, going back to that love. So the writing aspect, trying to figure out, we're looking at ways to expand my territory. I can only see so many patients a week, right? I'm
right,
licensed to practice medicine in the state of Texas, so I can't be everybody's doctor. But one of the
right.
things that I can do is figure out a useful way to provide information to more women, to impact more women. That means speaking engagements, that
Mhm,
means books, that means coaching, that
mhm.
means all of those things that I am able to help women navigate these things and navigate, how to make how to live a more balanced life. Um, and so that's kind of my passion. Like I said, that's just women's health has always been my thing. So
Mhm.
including with women's health, uh, mind strategies, goal setting, all of that.
It's funny. I knew that, but I want you to tell the world. It's very funny how God is putting everybody in the same trajectory at the same time. And it was
Mhm.
funny because me and Tracy was watching Super Bowl and we was talking, and she was raving about you, and she was telling me this and that. So I gotta call Rosalyn. Yeah, so because we all at the phase down, we're going to the next level,
That's right.
and so now we can help each other
That's
uh,
right.
make it happen to where it's going to be. What I
Mhm.
would suggest as well is to you have your own YouTube channel
Mhm. Mhm.
and be that doctor that could give, you know, each video could be something different about women's health that you
Mhm.
could maybe inform them on, so you could be the go-to doctor online that people
Mhm.
could talk to because the energy that you put out, even though I know you, but even if you put it out right now, his energy is someone I know I could trust.
Oh, I appreciate that. I appreciate
You,
that.
you're
I
welcome.
appreciate
And so
that.
and it comes across online as well. So I know that you will do well with that because the energy you put out is they will look at you and listen to your videos and say, I know this person care about me.
Yep, and that's so important. There is a lot of misinformation out there. I do spend quite a bit of time, I think, in my practice dispelling a lot of myths. People come with some things that they've seen, and I'm like, "Who told you that?"
Right.
So, so I do think reputable information is very
It's
important.
key.
It's very important, and people are so hungry for it. Women, men, and men too are so
Mhm.
hungry for how do I take care of myself better? Like we are having these conversations, and people are like, "What should I eat? What do I do? What type of supplement? What's your favorite probiotic, Dr. Miller?" So we're asking and we're wanting these things, and a lot of the literature we're just not included in the conversation. So
Mhm.
I think it is important for physicians who look like me to be that person to help navigate this huge amount of information that people are seeing on social media. I really do.
Right.
Yeah.
So my final thing for you is to give a parting shot to the masses. What's a word, some words of inspiration to
Yeah.
the people who may need it at this present moment?
Words of information, words of some inspiring words. Let's see. Uh, Life is such an incredible journey. And I think once we realize that it's a journey, that you don't get so caught up on that destination, um, and you're willing to learn at each aspect. So it's never really failure. It really is more about, did I learn? And if you learned about it, you keep it moving. Um, I'm just so grateful every day, that I do what I love, and that God has placed it in my heart to expand that and do even more. So I'm in awe every day of just life in general. And I think if when you carry that spirit with you, then it's literally limitless. So that would be my word of inspiration. Find something that, speaks to you, speaks to your heart. It's always service first, and the rest of it will come. So how can you use your life for service? How can
Mhm.
you use your purpose for service? When you kind of set things up that way, like, how am I serving others? Then the
Right.
rest of it will fall into place. Fall into place.
Absolutely. To piggyback off that is that's one of the things I ask myself every day is when I wake up is how can I be of service to someone today? Who
Mhm.
can I serve? And not be concerned about the monetary because that will come because you're being obedient to the fact that he wants you to serve. And
Right.
if everybody understands that we were created to be servant leaders of service, you know, it'll be a lot more great things happening for us as a general, and we'll be more blessed because we are being,
I agree.
servant leaders, which is what we're supposed to be doing.
I agree.
And
I
so, I want to thank you so much for being
Yeah.
a light on this video. I'm truly grateful to you. I'm truly proud of you
Thank
and
you.
who you have become. Um, just to see you from college
I
to
know,
now,
right?
you
I think
know,
you probably met me when I was like, maybe I started college at Eastern. I was 17, and I turned
wow,
18. I turned 18 my freshman year. So I was probably 19 by the time you met me. So that's a long time.
yeah.
It's a long time. It's a
And
long time.
to see you who you are now and what the greatness that you're doing, to see your beautiful children, it's
Appreciate it.
really heartwarming to see not just you, all of us doing amazing
Yeah.
things.
What we are designed
And
to do.
exactly. So thank you again,
Yeah.
and continue doing great things, Rosalyn.
I appreciate you. Thank you
You're
for
welcome.
having me.
Thank you.
Alrighty.